We certainly at Keiser have a priority for having the nursing students in actual clinical settings with their instructor. We feel like that is the best place for them.
This is our nursing mobile simulation lab. Nurses use a tremendous amount of simulation in order to be able to teach critical thinking and advanced skills to students in a safe environment.
It can be a little less scary perhaps than taking care of a real person, although we really encourage the students to get into the simulation and to always treat the mannequin as though this is a real person.
It used to be we did learn in the classroom, learn in the lab, and then go take care of patients. But we discovered that simulation can be integral to their learning.
So this lady or gentleman is controlled by what we call a simulation pad. And this will allow us to do things such as set her heart rate, teaching people about signs of stroke. We could simulate that in a mannequin, teaching them signs of a heart attack so that they would know when to get care.
She opens her eyes, she talks to you, she makes noise, she coughs, she throws up, she yells. You can use voiceover, so the simulator who's controlling it can actually voice through the mannequin, and it's all being recorded. And that's probably one of the key things that makes simulation so much more effective. The students can come in and see their after action video and watch the actions that they took to see if that actually helped the patient. And so they learn by watching their own mistakes or by watching what they did correctly.
I think it's created excitement in the students because I think they are seeing that Keiser is so invested in them and their education that they're willing to put something like this together, make it available to not only the students but to the public. We want people to know about Keiser. We want them to know that Keiser is invested in the education of nurses. And we really hope that our nurses go out into our community.
It's a great partnership because my students use their hospital to do clinicals and they can use our sim lab in turn, and that we work closer together and we make sure that we're all doing education. So maybe some of those people that work there were our graduates.
Education is always huge for nurses, and I think this shows that Keiser is really committed to educating our community and making them safer and healthier.